In this session, we'll be dealing with the applied aspects of blood supply of brain and spinal cord along with the blood-brain barrier. So what is clinically important here? So blood-brain barrier, the brain and spinal cord need a stable environment to function normally. This is provided by presence of semi-permeable barrier called blood-brain barrier. So it protects the brain and spinal cord from potentially harmful substances. So blood-brain barrier will have these three components, namely the capillary endothelial cells along with their tight junctions, the basement membrane of capillary endothelium, and foot process of the astrocytes. The tight junctions between endothelial cells is the most important thing. You can see here the capillary endothelial cells with the tight junctions, the basement membrane, and foot process of the astrocytes. Areas divided of blood-brain barrier are the pineal gland, the posterior lobe of the pituitary gland, tuber cinereum, wall of the supraoptic recess of third ventricle, area posterior at the lower end of the floor of fourth ventricle, inferior wall of pineal recess, and interventricular foramen. So these areas, the capillary endothelium has fenestrations, okay, across which protein and small organic molecules may pass from blood to the nervous tissue. So these are the sites where the neuronal receptors may sample the chemical contents of plasma directly. The hypothalamus, which is involved in regulation of metabolic activities of the body, reacts suitably and modify the activities, thereby protecting the nervous tissue. So any injury to the brain by trauma, chemical toxins, or inflammation, meningitis will alter the blood-brain barrier and allow the diffusion of large molecules into nervous tissue. So certain drugs like chloramphenicol, tetracycline, sulfonamides, so they pass through the blood-brain barrier, whereas few drugs will not pass through the blood-brain barrier, like phenylbutazone, neurotransmitters, epinephrine, dopamine cannot cross the blood-brain barrier. So in infants, blood-brain barrier is not fully developed, so therefore serum bilirubin level, if it is high, the bilirubin readily enters the brain tissue, producing a condition called connectivus. So in Parkinson's disease, the deficiency of dopamine in corpus striatum results the Parkinson's disease. So directly, if you give dopamine, cannot cross the blood-brain barrier. So we need to give a precursor of the dopamine, the L-dopa, levodopa. So this will cross the blood-brain barrier easily and get converted to dopamine. So in order to compare and contrast, so in the blood-brain barrier, you have seen the capillary endothelial cells with tight junctions, then the basement membrane and the foot process of astrocytes. We also have blood CSF barrier, which is having the endothelial cells which are fenestrated. The fenestrations are covered by diaphragms, the basement membrane of capillary endothelial cells, and then the basement membrane of choroidal epithelial cells and the tight junctions between the choroidal epithelial cells, and the scattered pale cells, which are the modified pile cells between them. So endothelial cells are fenestrated, whereas in blood-brain barrier, endothelial cells have tight junctions. So basement membrane of capillary endothelium, basement membrane of choroidal epithelial cells, and the choroidal epithelial cells with tight junctions, and the scattered pale cells between these two basement membranes. You can see here. So this is a modified ependyma. You can see the tight junctions between the ependymal cells. You can see the modified pia. This is the basement membrane of ependymal cells. This is the basement membrane of capillary endothelium. You can see these are the capillary endothelium with fenestrations. Let's see CSF barrier. So now coming to the actual applied aspects, you can see here in this diagram, you are seeing certain berry-like structures. These are called the aneurysms, congenital cerebral aneurysms. They are berry-shaped, so they're called as berry aneurysm. What is happening here is the tunica media is defective, resulting in berry-shaped aneurysms, and most likely they are occurring at the bifurcation. If you see the occurrence, see that the bifurcation of middle cerebral artery, you can see a berry aneurysm. You can see at the junction of artery communicating with the anterior cerebral. You can see at the bifurcation of the basilar artery into posterior cerebral, you can see the aneurysm. So cerebral angiography. So it is a radiological technique to visualize the vessels of the brain. A radiopaque solution is injected into one of the major arteries supplying the brain, and serial radiographs of skull are taken approximately 1 second intervals. The injection into the common carotid artery or the internal carotid artery shows the distribution of middle and anterior cerebral arteries called carotid angiogram. You can see here. So this is the carotid angiogram. You can see the anterior cerebral artery and middle cerebral artery. You can see a block here. You can see the narrowing of the lumen here. And the injection into the vertebral artery permits the resolution of vertebral, basilar, and posterior cerebral arteries together with their branches. The cerebral angiography is valuable in identifying vascular malformations and aneurysms. It also provides useful information about occlusive vascular disease and space-occupying lesions. You can see here this is a vertebral angiogram. You can see the posterior cerebral arteries. You can see the narrowing here, and you can see a block here. So roots transradial approach. So catheter is introduced into the radial artery, then followed through brachial, axillary, subclavian, arch of aorta, then into the desired blood vessel. This is transradial approach, and we can also use femoral. So femoral, external iliac, common iliac, abdominal aorta, thoracic aorta, arch of aorta, and desired blood vessel. So you can see here, this is the MRI of the arteries of the brain. You can see this is the left vertebral artery. You can see the left common carotid artery. You can see the right vertebral artery. You can see the right internal carotid artery. You can see the basilar artery here. Two vertebral arteries joining to form the basilar artery. So here you can see the carotid siphon, right internal carotid, left internal carotid. So left vertebral artery, right common carotid artery, left common carotid artery. This is a CT image. So this is an MRI image. This is a contrast enhanced CT image. So what is this zone of diminished nutrition? So there are two types of branches, namely the cortical branches which supply the cerebral cortex, and central branches which supply the central areas. The short cortical arteries do not penetrate beyond the cerebral cortex, while the long cortical arteries do traverse the cortex to supply the white matter up to a depth of 4 to 5 centimeters. Then the deep portion of the white matter is supplied by the central branches. There is a zone of diminished nutrition between the territories of cortical and central branches. So the formation of cavities due to senile softening of the brain are mostly seen in this zone. So thrombus of intracranial venous sinuses. So this is the one of the commonest problem affecting the cerebral venous sinuses. So this results in blood clots within the intracranial dural venous sinuses or intracranial veins. So the causes of obstruction of venous drainage and produces life-threatening complications. So you can see the phase contrast magnus resonance venogram. So you can see the lateral view. Here you can see the straight sinus, and here you can see the confluence of sinuses. You can see the sigmoid sinus. You can see the superior sagittal sinus. This is the lateral view. You can see here the frontal view. You can see the superior sagittal sinus, confluence of sinuses, transverse sinus, and sigmoid sinus. So here you can see the superior view. This is the superior sagittal sinus, confluence of sinus, transverse, and sigmoid sinus. So here you can see a CT venogram, sagittal section. You can see the superior sagittal sinus, confluence of sinuses. You can see the inferior sagittal sinus, internal cerebral vein. You can also see the sphenoidal air sinus. So now intracranial hemorrhage. So these are the four types: extradural hemorrhage, extradural outside the dura. So the result of anti-division of the middle meningeal artery is the most commonest cause. Then subdural hemorrhage. So the most commonest cause is tearing of the superior cerebral veins. So subarachnoid hemorrhage, the leakage or rupture of the congenital aneurysm on the arterial circle of the villus. So this results in subarachnoid hemorrhage. So if an intracerebral hemorrhage, rupture of the thin-walled lenticular branches, especially the Charcas artery. If you see out of this extradural, subarachnoid, and intracerebral, all these are due to arteries, whereas subdural hemorrhage is due to veins. So you can see this is the extradural hematoma. You can see this is the subdural hematoma. You can see the shift in the lateral ventricle. So subdural hemorrhage, it occurs due to rupture of cerebral veins in the subdural space. The cerebral veins, while traversing the subdural space en route to drain into the dural venous sinuses, have little support and are torn following moderate trauma on head. The superior cerebral veins are most commonly torn where they enter the superior sagittal sinus. The cause is usually blow on the front or back of the head, resulting in excessive anteroposterior displacement of the brain within the skull. The cerebral veins in the subdural space, they are called as bridging veins, which are unduly stretched and torn. Subdural hemorrhage is generally extensive because of the loose attachment between the dura and arachnoid. So here you can see the subarachnoid basal system with the bleeding, subarachnoid hemorrhage. The subarachnoid hemorrhage commonly results due to rupture of aneurysms. The subarachnoid hemorrhage produces sudden severe pain in head, followed by mental confusion. The death may quickly occur, or patient may survive the first bleeding only to die few days or weeks later. You can see the intracerebral hemorrhage most commonly due to the Charcot's artery cerebral hemorrhage. So anterocerebral artery, so it mainly results in contralateral hemiparesis and hemianesthesia involving mainly the leg and foot due to involvement of upper parts of the primary motor and sensory areas in the paracentral lobule. There will be inability to identify the objects correctly due to involvement of supraparietal lobule. Apathy and personality changes due to involvement of part of frontal lobe. So the middle cerebral artery occlusion results in contralateral hemiplegia and hemianesthesia involving mainly the face and arm due to involvement of most of the primary motor and sensory areas. Aphasia if left dominant hemisphere is involved due to involvement of motor and sensory speech areas, and contralateral homonymous hemianopia due to involvement of optic radiation. And posterior cerebral artery occlusion again results in contralateral homonymous hemianopia due to involvement of visual cortex with some degree of macular sparing. The macular vision is spared because it is represented in the occipital pole, which receives a collateral supply from middle cerebral artery. Anastomose exists between branches of middle and posterior cerebral arteries in the region of occipital pole. Thank you.